Assalamu alaikum, my name is Humna Asif and I'm from grade 5C. So today we will talk about coronavirus. What is coronavirus? The group of viruses that is zoonotic in nature, coronaviruses are transmitted between animals and people. In humans, the virus is known to cause respiratory infections. Symptoms of COVID-19. There is range of symptoms from mild, moderate, severe to critical. Most common symptoms of COVID-19 are fever, dry cough, or dryness. Less common symptoms are aches and pains, sore throat, diarrhea, headache, loss of taste or smell, or rash on skin. Serious symptoms of COVID-19 are difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it takes up to 14 days. Now for expert opinion, let's have a look on this interview that's by Professor Muhammad Umar Sitar Imtiaz, Vice Chancellor, Rawalpindi Medical University. Let's see what he says about the world after COVID-19. Assalamu alaikum, my name is Humna Asif and today we will talk about world after COVID-19. Related to this topic, we have a very special guest, Vice Chancellor of Rawalpindi Medical University, Professor Dr. Muhammad Umar. Sir, I'm really thankful and very welcome.
Thank you very much for the invitation for this documentary. Thank you.
Sir, so as being a health professional, how will you analyze the situation about COVID-19?
This pandemic of COVID-19 is a great time in the history and rather difficult time.
Yes, sir.
And if we go back to the history, it was 1918, almost 100 years before, when we first time on this planet have pandemic situation like this with the flu, which is called the Spanish flu.
All right, sir.
Which involved about 50 million people and killed about more than 5 million people at one time. And unfortunately, by living at this point of time when we have another pandemic of COVID-19, and it is affecting millions of the peoples, and 500,000 population unfortunately died.
Sir, so my second question from you will be, how will you see after the world of COVID-19?
I think the COVID has changed not only the medical practices, but is it going to change the economy of this world? Because economy is affected badly. It is going to change the social norms. It is going to change the thinking process, the medical practices, the technology innovations, and even the psychology of the people. And you can imagine in last 6 months, whole world is just online. So this is the new era after COVID-19 I am looking at.
All right, sir. So how people will continue their job after COVID-19?
I think after COVID-19 they have to change their working processes. As I was mentioning, that the most of the thing will be IT based. They will be online, and many things. The social norms are going to change. As you know that now we have a physical distancing. We have to wear the mask. We have to take care of these infections which can transmit human to human, and we have to do the safe practices even at the working offices, at the working places, and follow some SOPs for long times.
All right, sir. So my last question from you will be, what message, what special message will you give to the people of our world?
I think my message will be that the COVID is still not over, and I believe as a healthcare professionals that this will continue maybe another year or so. May not be the same severity, so we should strictly follow the SOPs which are by the WHO and CDC and by the government of Pakistan and healthcare professional, and the only safety will be if we follow those SOPs.
Sir, I'm really thankful that you have given your precious time for us from your very busy schedule. I'm really thankful for you.
Thank you very much, Amna. You're always welcome.
Thank you, sir. The coronavirus disease, COVID-19 pandemic has fundamentally changed our lives and the way society functions, likely having lasting effects. Without a doubt, trying to maintain our normal routine without as difficult, it's even more challenging for individuals with chronic disease and disorders, as the very support systems they need. That is the healthcare system that are focusing resources and efforts toward looking after patients infected by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. Communities have come together during these difficult times to help one another. Many companies, organizations, and individuals have stepped up to donate medical supplies, relieve customers of monthly bills, and provide food and shelter to those in need. Despite their circumstances, we have shown an incredible amount of strength and care for one another. We wish you all the best as you endure this pandemic. Stay safe, stay well.